Hello everyone, my name is Angelo Tenorio and I'm here with Crystal Barbosa and Crystal Dumas, and we'll be talking about the pelvic inflammatory disease, what it is, the cause, the transmission, symptoms, complications, treatments, and what you can do to prevent it from happening to you.
What is PID, or pelvic inflammatory disease, is an infection of a woman's reproductive organ. What is cause? The main cause of PID is through a sexually transmitted infection, or STI, such as chlamydia, gonorrhea, or mycoplasma genitalium. These bacteria usually only infect the cervix, where they can be easily treated with antibiotics.
Mode of transmission. PID can be caused by a variety of bacteria, the most common of which are gonorrhea or chlamydia infections. These bacteria are typically acquired during unprotected sex. Symptoms. There are no PID tests. Your medical history, physical exam, and other test results are usually used to make a diagnosis. PID symptoms and signs can be subtle or mild. Some women have no signs or symptoms at all. As a result, you may be unaware you have it until you have difficulty getting pregnant or develop chronic pelvic pain. However, if you do experience any symptoms, they must often include lower abdominal pain, unusual or excessive vaginal discharge with an unpleasant odor, discomfort or pain felt deep inside the pelvis during sex, bleeding between period, and lastly, pain when peeing.
Complications. Untreated pelvic inflammatory disease might cause scar tissue and pockets of infective fluid abscesses to develop in the reproductive tract. These can cause permanent damage to the reproductive organs. Complications from this damage might include ectopic pregnancy, infertility, chronic pelvic pain, and tubo-ovarian abscesses. Treatments. If PID is diagnosed early, it can be treated. However, treatment won't undo any damage that has already happened to your reproductive system. The longer you wait to get treated, the more likely it is that you will have complications from PID. Your healthcare provider will prescribe a combination of antibiotics to start immediately. While taking antibiotics, your symptoms may go away before the infection is cured. Even if symptoms go away, you should finish taking all of your medicine. Be sure to tell your recent sex partner or partners so they can be tested and treated for STIs too. It is also very important that you and your partner both finish your treatment before having any kind of sex so that you don't reinfect each other. If you are pregnant, seriously ill, have a suspected abscess, or haven't responded to oral medications, you might need hospitalization. Surgery is rarely needed. However, if an abscess ruptures or threatens to rupture, your provider might drain it. You might also need surgery if you don't respond to antibiotic treatment or have a questionable diagnosis, such as when one or more of the signs or symptoms of PID are absent. You can get PID again if you get infected with an STI again. Also, if you have had PID before, you have a higher chance of getting it again. Prevention. The only way to avoid STIs is to not have vaginal, anal, or oral sex. To reduce your risk of pelvic inflammatory disease, first, practice safe sex. Use condoms every time you have sex, limit your number of partners, and ask about a potential partner's sexual history. 2. Talk to your healthcare provider about contraception. Many forms of contraception do not protect against the development of PID. Using barrier methods such as condom helps to reduce your risk. Even if you take birth control pills, use a condom every time you have sex with a partner to protect against STIs. Third, get tested. If you're at risk of an STI, make an appointment with your provider for testing. Set up a regular screening schedule with your provider if needed. Early treatment of an STI gives you the best chance of avoiding PID. 4. Request that your partner be tested. If you have pelvic inflammatory disease or an STI, advise your partner to be tested and treated. This can prevent the spread of STIs and the possible reoccurrence of PID. 5. Don't douche. Douching upsets the balance of bacteria in your vagina.